Well, come along today to ShopRite in Douglas, and we're talking about pharmaceuticals and their usage. We've got this big sign about don't need it, don't order it. Maria, you work with the government on this, and you are in past life a pharmacist, I believe?
I am still currently a pharmacist.
Yep. And of course we've got the lady who's in charge of the big spend, of course, the biggest department in government.
It's a lot of money.
How much money is therefore wasted on people? Is this ordering but not needing items?
Yes, ordering them and not needing them, or getting them home and finding out they didn't actually need them. They thought they had to order everything on their repeat prescription. So it's covering a lot of angles. But we reckon there's somewhere between 200 and 300,000 at least that's gone on wasted medication. So really this is about highlighting the fact, because we could use that money for a 24-hour thrombolysis service for people who need it following a stroke. And it's highlighting what people need to be aware of, because people are not checking. They're stockpiling medicine at times in the house, and unless it's kept safely, then children or pets can get at it, and it can get out of date. Right. So there's a danger to people to have a stockpile, but we're really encouraging them to talk to their doctors, talk to their pharmacists, to see if everything on the repeat prescription needs to be there, and also to reinforce the fact that just because it's on a repeat prescription, they don't have to tick all the boxes. They don't have to have everything at once. And if you don't tick it, you don't lose it. It's still there. You can order it again when you do need it. But I would also encourage people to actually, if you're given a bag of medication, open it and have a look at it, because you can still give it back at that time to the pharmacist. But once you've taken it away, it becomes a safety issue, and it can't just go back into the pile. And it's the same with people going into hospital. Take your medication with you in a bag that's clearly labelled that it's your medication, and then it can be used for you in hospital rather than ordering more.
Maria, you're on the coalface of this, I guess. You see this. Can you influence people? Do you actually say, do you need this? Or is that something you can't really get involved in?
Yeah, I think it's really important for the public to know that this is just one part of a medicines management scheme that we're working on at the moment. You know, we have a very, very high spend on pharmaceuticals in primary care, and it's really important for the public to know that we're not trying to restrict what they get when they need it. It's their medicine. But I think the majority of the public are aware that it's a finite pot of money, and anything that they can do to help us not necessarily save the money but use it better to the services that really need it is key. So our pharmacists are being encouraged to basically educate the public. It's nobody's fault that they don't know these things already. So each time people are ordering repeat medication, they're going to be reminded to check what they need.
If it's repeat, though, is that, I mean, the doctors don't get involved because it's just sitting with the pharmacy that they can get it? I mean, should people go back to the doctor every now and again to check they still need the medicine as well?
The repeat medication is put on someone's record for a set period of time, usually 6 months or a year. And in between those periods, the doctors don't necessarily need to be involved. The pharmacists can help the patients decide if they do or don't want it. I think, unfortunately, there's a misconception that unless they order it every month, they might lose it, so it might be removed from them, and that's not the case.
This is something that sounds pretty obvious, basically, but we're all probably guilty of it somewhere along the line. If the doctor says to get it, we must take it and use it, and it sits in a cupboard somewhere. This is costing how much again?
Well, it is. I mean, we're spending 16 million net on prescription items, and that's excluding the hospital. Yeah. And when you think that we're asking those who do pay, which is only 10%, we're asking them to pay £3.85 for it. Some of those drugs can cost hundreds of pounds. I mean, some of the inhalers that are on prescription are about £60 each, and it soon mounts up. It really does. So, I mean, every penny counts. We've overspent significantly in the last 2 years, and we have to get a grip of that budget. But I don't want to be just looking at ways of saving money and addressing the deficit. We have to look at improving the service as well.
So you're talking to pharmacists as well,
Yep.
to educate them to be more interactive with people?
Yes, so when patients come to the pharmacy, they may order their repeats through the pharmacy. They'll be encouraged to think about what they have at home and to bring in anything that they no longer need or indeed has gone out of date.
Ah, right, because we've all got that. Things that we haven't quite finished a prescription or
Yeah.
whatever, you should bring them back in, should you?
So basically all medication that's gone out of date or you no longer need presents a risk if it's kept in the home. So the pharmacists will happily take that and basically it gets incinerated, unfortunately, because anything that leaves the pharmacy is no longer considered to be sort of carefully managed.
Yeah.
But if people could check what they've got, go through their cupboards and return what they no longer want, that would be helpful. And then each intervention that they have in the pharmacy, they'll be asked to make sure that they really need all those items.
So you're looking for savings. I mean, how big is your overspend going to be this coming year? You're not going to tell me, are you? But it's too early to
silly,
I know,
don't be
but
silly.
you clearly wouldn't want one, I suppose.
I certainly don't want one. I certainly don't want one. And we're looking at everything to try and make sure that we don't have one this year. We're doing our utmost, but what we're saying to the public in this, please do your bit to help us, not just to save money, but to improve the services. As I said, £200 to £300, we can have a 24-hour thrombolysis service for people who need it following a stroke.